Indeed, not many people cheering, and of course this comes on the back of the discovery of a new COVID-19 variant affecting tourism in South Africa this festive season and creating a lot of uncertainty. Let's talk about that now. Reputation experts say South Africa needs a clearer strategy for the release of information on the discovery of new variants. This after countries worldwide and the entire EU bloc barred travellers from South Africa and other southern African countries almost immediately after some details of the new variant Omicron were released by scientists here in South Africa. To discuss, we're joined by Solly Moeng from Don Valley Reputation Management and Tshepo Matseba, who is the MD of Reputation First. Thank you for being with me, gentlemen. Let me start with you, Mr. Moeng. What could have been done differently? Surely not much, because when there is a global pandemic and lives can be saved, surely no scientist is able to sit on any information or any discovery, large or small.
Yes, absolutely. Good afternoon, Francis, and to your listeners out there, and Tshepo. Look, when you're going to make an announcement that is potentially controversial or that might, lead to this kind of knee-jerk reaction as we have seen, you need to have a plan around it. You don't just go to the podium, make your announcement and walk away. There's got to be some kind of scenario planning ahead of making such an announcement. What is going to be thrown at? What could possibly be thrown at us if we do this? Are we the right people at the right time? Did we think about how to respond to whatever could be said? How do we prepare before we throw the message out there? How do we prepare the audience for what's happening? I don't think there was sufficient planning in there. I don't totally agree that there's got to be coordination between government, scientists, but they need also communication experts. Government people and scientists are not necessarily trained in communication, in working, especially really difficult situation where this kind of knee-jerk reaction is almost inevitable.
Well, let me put you on the spot, Mr. Moeng. What can you say? Because there is so much uncertainty around this new variant. Well, what could they have said beyond saying, look out world, we've discovered something?
Well, they could have, as I said, they could have coded. We had the scientists. You must remember that the original reaction by people was, how can these South African scientists just say stuff like that? They should have kept quiet. And then later on we said, but wait a minute, they have the ethical responsibility to announce these things. But they should have said, they should have prepared the world for it, to say, look, we have an announcement to make. And it's important that people understand that this is a very, very sensitive announcement because this is what it entails. And then made sure that the message is presented in a way that people don't start saying, oh, is it that bad in South Africa? Because the understanding was not they have discovered something and the world has to be aware of it. It was like we are dying here in South Africa. I mean, the impression that was given, and I'm sitting here in Switzerland, people are saying, what's going on in your country? Is your family safe in South Africa? So that the message was not presented in a way that said, look, we're not saying it's already spreading all over the place in South Africa. We're saying we have discovered a strain, and this is what it means, and this is what we think the world should be doing about it. There was not sufficient cushion, as it were, put around the announcement.
Yeah. Mr. Matseba, do you agree that in a sense the scientists were alarmist?
I would take it a little bit further and say there seemed to be a serious, this discussion we're having now, and this calamity has really showcased the poverty through which engagement and conversation and stakeholder engagement happens in South Africa. You wouldn't expect scientists or any experts, in fact, to outline a potential crisis that would have an impact on the economy, that would have an impact on healthcare, or that would have an impact on indeed lives and communities. You wouldn't expect that type of information to be exposed without necessarily having had an opportunity to have discussions behind the scenes between the security cluster, between the economic cluster, and other clusters of government, but also to give the private sector.
Would the scientists then, would South Africa then not have been accused of sitting on crucial information for the world? You can't have a security cluster meeting when you've just found a new variant in the global pandemic, surely.
No, absolutely not. So remember, I'm talking about an example around key clusters of our society and key clusters of our economy, not just the security cluster. So economics matters, treasury matters, and in this context, there was a missing link. The fact that you are having conversations behind the scenes to prepare the market for difficulties ahead does not mean that does not equate to non-disclosure or hiding information. And so as a country and as a continent, I believe that we had an opportunity to frame the message. I think Solly is correct in saying we should have framed the message correctly and provided the facts so that by the time we reach international markets, everybody would have been prepared. Because the message is as much as it is about the message itself, as it is about the strategy and who are the people that need to connect the dots so that the message makes sense to different parts of the world. So it was not simply about let's be first to shine or let's be first to distribute or let's be the quickest, because you can be quick and create a disaster as we are seeing right now with the impact of this on our nation brand, but also the impact of this on our tourism sector.
Yeah. Mr. Moeng, you were saying how this was being covered internationally. Does government have another role now? It was interesting, one of our guests yesterday said that, in fact, the UK Prime Minister should not be able to get up and just say things about South Africa without being scared of receiving a call from the South African president and all the leaders in Southern Africa saying you are misrepresenting us. And I'm even thinking some facts could be put out for the world. For example, Belgium had a case and that was linked to Egypt. Have we put pressure on Belgium to show that traveller was in Southern Africa? Are all these cases linked to Southern Africa? Should we be pushing and even pushing publicly to find out what is going on and to hold those governments accountable who are barring us from travel?
Look, there are two sides to this story, of course. The ones we don't have control over how people respond to what we say, or we know that there's usually a knee-jerk reaction anyway to things coming from Africa. There's this suspicion that we still need to understand the basis of, but we also have to take responsibility. We need to, knowing that people tend to react the way they do to us, we need to be better planned. Matseba is correct. We need to say, we have this bombshell of an information to put out there. How do we plan it in a way that it doesn't hit back at us? Because people are going to respond badly to us anyway. But running around saying, but you guys tell us who those diplomats are and whether you had it in there before, it's futile to do that. We should control how we do things. We should plan better. This pandemic is not new. The teams that work on major potentially harmful announcements must be in place all the time. We're not asking people to start running around looking for people to be a part of it. The scientists should know what number to call when there's a big announcement to make. There's no hurry for them to say, we have to make this announcement today, now, in 5 minutes, so that we are the first ones to make the announcement. They should say, this is going to potentially bring harm to us. This is harm. What's going on to South Africa is really harmful, all right? How do we know? How do we make sure that we call the right? When you have a crisis team, because you are in crisis, you need to know who the people are to call when you have an announcement to make, and you don't have to be running to the podium, to the microphone, just because you want to be the first person to make the announcement. You need to be able to avoid this sort of thing from happening in the future, because we're not going to run around the world saying, yeah, but you guys did this and did this. They are wrong. The world is wrong. We know that. But we have no control of them. We have control of what we do and how we do what we do.
Okay, so start the control right at the beginning. Mr. Matseba, you can comment on that. And also, I'd love your comment on, we are in a crisis. We're talking about reputation management and crisis management here in South Africa, in that so few people are vaccinated, 35% of the adult population. And I'd like you to assess how government has fared. Some have said it's very tricky for government. If they push vaccinations too hard, the backlash could be huge. Now we're looking at vaccine mandates. Some have suggested that the scientists should be allowed to speak, that government should speak less, or was there an opportunity to market and in a sense to sell vaccines so much better to South Africa?
Yeah, I think there's been some progress. The problem with South Africa is, and perhaps Africa, but let's talk about South Africa. The problem with South Africa is that we want to talk about the positives of vaccines, but in the middle of all this, there's COVID-19 corruption. which creates a vague environment where people then begin to say, but is this actually genuine at a community level? And what are the interests of the private sector? And they start creating their own theories and analysis in communities. And those theories and analysis begin to impact how the authentic message gets to land in communities. And we're also, as a country, really not good storytellers. When you look at all the messages, it's very much top-bottom approach, where the big top leaders are giving instructions to people to change behavior. And if you want to change behavior, you have to engage the community, you have to engage the audience and make them feel part of the process, make them understand, educate them about the value of vaccines and demonstrate, especially given South Africa's history with vaccines and history with diseases or difficulties such as HIV and AIDS. And so we have the experience, but we are very, very poor at telling the story in a meaningful and an impactful manner. But worse, one of the issues that crossed my mind this past few days was the irony of a lack of coordination and communication by African leaders. The leader of Rwanda, for example, said, "Well, let's impose a travel ban." But as part of the African Union's 55 member states, one would have expected that the AU and SADC would have a coordinated message around this challenge of this variant, so that the world can see Africa's view for probably for the first time. And I think African leaders are losing out on opportunity to lead and demonstrate that Africa matters in geopolitical matters globally.
Yeah, we often don't move together on these big decisions. Thank you both for your time tonight. That was Solly Moeng from Don Valley Reputation Management and Tshepo Matseba, MD of Reputation First. We take a short break. Lots more to come on The Full View.